Hello and welcome. Today we're diving into a serious and prevalent health issue, alcoholic liver disease. This comprehensive overview will cover everything from its causes and progression to diagnosis, treatment, and prevention. Understanding this disease is crucial, not only for healthcare professionals, but for anyone concerned about liver health. Alcoholic liver disease, or ALD, is directly caused by excessive alcohol consumption. The liver's primary function is to metabolize alcohol, but when overwhelmed by large amounts, it becomes damaged. The exact amount of alcohol that leads to ALD varies depending on individual factors such as genetics, gender, diet, and the presence of other liver conditions like hepatitis. However, generally, consuming more than 2 to 3 standard alcoholic drinks per day for several years significantly increases the risk. The pathophysiology of ALD is a complex process involving several stages of liver damage. Initially, excessive alcohol leads to fatty liver, also known as steatosis, where fat accumulates within the liver cells. If alcohol consumption continues, this can progress to alcoholic hepatitis, an inflammation of the liver. This inflammation can cause liver cell damage and eventually lead to fibrosis, the formation of scar tissue. Over time, this fibrosis can become irreversible, developing into cirrhosis, where the normal liver structure is replaced by extensive scar tissue, impairing liver function and leading to various complications. Alcoholic liver disease is a significant global health concern. It is one of the leading causes of liver-related morbidity and mortality worldwide. The prevalence of ALD varies depending on geographic location and alcohol consumption patterns. It's more common in developed countries with higher rates of alcohol use. Men are generally more susceptible than women, although women are more likely to develop liver damage with lower levels of alcohol consumption. Socioeconomic factors also play a role, with higher rates often observed in populations with limited access to healthcare and support services. The signs and symptoms of alcoholic liver disease can vary widely depending on the stage of the disease. In the early stages, like fatty liver, there might be no noticeable symptoms. As the disease progresses to alcoholic hepatitis, symptoms may include abdominal pain, nausea, vomiting, fatigue, jaundice, which is a yellowing of the skin and eyes, and fever. In advanced stages like cirrhosis, symptoms can include swelling in the abdomen and legs due to fluid buildup, easy bruising and bleeding, mental confusion or disorientation known as hepatic encephalopathy, and enlarged blood vessels in the esophagus and stomach, which can rupture and bleed. It's crucial to recognize these symptoms and seek medical attention promptly. Diagnosing alcoholic liver disease involves a combination of medical history, physical examination, and various diagnostic tests. A detailed history of alcohol consumption is essential. Physical examination may reveal an enlarged liver, jaundice, or fluid retention. Blood tests, including liver function tests, can assess liver enzyme levels and indicate liver damage. Imaging studies, such as ultrasound, CT scans, or MRI can visualize the liver and detect abnormalities like fatty liver inflammation or cirrhosis. A liver biopsy, where a small sample of liver tissue is taken and examined under a microscope, can provide a definitive diagnosis and assess the severity of liver damage. Alcoholic liver disease progresses through distinct stages. First is alcoholic fatty liver, or steatosis, which is often reversible with abstinence. Second is alcoholic hepatitis, characterized by inflammation and cell damage. This stage can range from mild to severe and can sometimes be fatal. The final stage is alcoholic cirrhosis, a severe and irreversible condition where the liver is scarred and unable to function properly. Cirrhosis can lead to liver failure and other life-threatening complications. The cornerstone of treatment for alcoholic liver disease is complete abstinence from alcohol. This allows the liver to heal and prevents further damage. Supportive care includes nutritional support to address malnutrition, vitamin supplementation, and medications to manage symptoms such as nausea, pain, and fluid retention. In severe cases of alcoholic hepatitis, corticosteroids may be used to reduce inflammation. For advanced cirrhosis, treatment focuses on managing complications such as ascites, hepatic encephalopathy, and variceal bleeding. In cases of end-stage liver disease, a liver transplant may be the only life-saving option. Preventing alcoholic liver disease starts with responsible alcohol consumption. Public health initiatives aimed at reducing alcohol abuse, such as education campaigns and alcohol taxation, are crucial. Individuals should be aware of the risks associated with excessive alcohol consumption and adhere to recommended guidelines for moderate drinking, which is generally considered to be no more than 1 drink per day for women and no more than 2 drinks per day for men. Early detection and intervention for individuals at risk of developing ALD are essential. The prognosis of alcoholic liver disease varies depending on the stage of the disease and the patient's adherence to treatment. Early stages like fatty liver can often be reversed with abstinence from alcohol. Alcoholic hepatitis can range from mild to severe, with a significant risk of mortality in severe cases. Cirrhosis is a chronic and irreversible condition, but the progression can be slowed with treatment and lifestyle changes. Recent research focuses on developing new therapies to reduce liver inflammation and fibrosis, as well as improving outcomes for patients undergoing liver transplantation. Furthermore, there is increasing interest in exploring the role of the gut microbiome in the development and progression of ALD.